Hi, I'm Dr. Julia Overstreet. I'm a podiatrist, and I'd like to take some time today to talk to you about mycotic and dystrophic toenail care. As our seniors increase in numbers, this is going to be a very important part of the duties of all healthcare practitioners who are willing to do it. I know it's not the glamour business, but you can prevent infections and even ulcerations if this care is done properly and regularly. So let's get started. These are your basics. 2 different sizes of clippers, a curette, and a Dremel. And we'll go over each of these in detail a little bit later, but that's the basics that you need to do professional care. The clippers, there's double action, the 2 sets of hinges here, and the single action, which is of course the more common. The double action clippers give you more ergonomic ability to cut through the thicker nails, although I have to say you're only going to be using the distal 2 or 3 millimeters of the blades. You don't put the entire thing, nail into here and clip down. But even when you're just doing the distal couple of millimeters of the nail, it helps to have that mechanical advantage in some of these nails. So double action clipper, single action clipper. These are not the kind of clippers that we use professionally when we're doing nails. That's fine if that's what your patients are using at home, but that's not what I mean when I'm talking about toenail clippers. The curette. There are hundreds of types of dermal curettes. What I like is a double-ended 2.5 millimeter and 3 millimeter curette. A curette, if you're not familiar with it, is sort of like a scoop or a melon baller. It has a smooth side on the bottom part of the cup, and the top ridge of the cupped area is a sharp edge. Not sharp like a scalpel, but sharp enough to kind of be able to soften or to get some extra debris out, and even nail debris if you use it properly. We don't use orange sticks, those little orange, but not orange, those little wooden sticks that pedicurists use. We use surgical instruments, and we learn how to use them properly. It's inappropriate to use an orange stick. It doesn't do what we need it to do. It's not disinfectable at the end, and we need to use the appropriate equipment to get the best job done for our patients. So you can see here, the scooped edge, the rounded edge, is up against the skin. And here the instrument's the other direction, although you can't really tell in this picture, and the rounded end is down towards the skin. You always have that more cutting edge toward the nail. You might use it in a case like this to clear out some of this debris and loosen up the edge of this difficult nail so that you can clip it better. You're not digging with the curette, you're not doing any damage, drawing blood. It's an instrument that, with any scope of practice, you can use if you use it properly. When the patients cut their nails, they cut them straight across, and we want them to do that. For a patient to cut their own nails, that's the safest way to do it. We're professionals. What we want to do is cut rounded. We want to bevel down these edges. There's an appropriate way to do that. We're going to go over how that is done, but it makes it a lot safer. Number one, as that nail grows out, you don't have those edges up here that are sharp, squared off points that cut into the adjacent nail or the other leg when they're moving around in bed at night. So you have it nice and rounded there. Number two, if it's done properly, which I'm going to teach you, you don't leave a little spike of nail out here that can grow out in the next couple of weeks and make an ingrown toenail. The number one cause of ingrown toenails, as I think we all know, is inappropriately cut nails. And I'm going to teach you some of the tricks so that you can do it appropriately and keep the patient safe as long as possible between toenail cuttings, because as we all know, they can't get in to see us as often as we'd like them to be able to these days. So what I'm talking about is here, you are seeing the nail go down, the cut go down into the sides of the nail, the border of the nail. You have to go all the way down. Would it be okay to leave this toenail the way it is now? Yes, it would. But I want to teach you the most professional way to do it and the way that will keep the patient safe from infection the longest. Here's your clipper. Now, I did say this is just a photograph. just to show you that we're going all the way out to the edge of the nail. As I said, I'm not normally putting the entire nail into the entire length of the jaw of the clipper, but just to the very end of it. So realize this is just a photo to show you it going all the way out to the end. Here again is the curette. We're freeing up underneath. We're making sure we did a good job. Realize that the toenails grow way deeper than what you're seeing. So that when you're cutting down that edge, you need to make sure that you are going far enough to get to the very edge of the nail, even if that is under the skin. And that's part of where the curette comes in. It helps you feel down under there to make sure you've done it when you can't actually see it. This is what happens if you don't. If you go just as far as maybe you can see, or you think you've gone far enough, and you leave this little spike, which is fine that day, but as the nail grows out, this becomes a spike, and it lacerates the tissue, and then bacteria pour in. That is an ingrown toenail, and you have created it. So you need to make sure you've gone all the way to the edge of this nail before you stop cutting. That's the only safe way to do it. So here's a little picture of it to show you. You've not gone all the way to the edge where the nail grows because it's hidden under the skin. So as that nail advances over the next couple of weeks, it lacerates the skin and becomes ingrown. And that's how this forms. This is inappropriate nail cutting. Now, does that mean we don't take the risk of cutting it appropriately down into the border like that? No, we're going to learn how to do that. Here's a situation where this is fine today, but this is growing up into that nail and going to cause this to become infected. So we need to cut this down, not into the skin. That's just the way this line goes to show you you're actually going down deep into that crevice down in there and getting the entire border out, rounding it off so that it can grow out appropriately. Dystrophic nails. The sander, the Dremel, you can get a Dremel anywhere. Fred Meyer, Sears, handyman stores. It's a hobby drill, and it comes with different bits that are for hobby skills, woodworking and that sort of thing. There are different kinds of things that people use with the Dremel when they're doing nail care. There are diamond burrs that are shaped like kind of like teardrops. There are different kinds of scored metal burrs. I like to use these sanding discs. They're cheap. They're disposable. So with each person, you don't have to worry about doing any disinfecting. You just throw this away. They're easily good enough one disc to go through 10 toenails. They're cheap. The problem is they are not readily available. You really have to go through a podiatry or a foot care specialty supply house to get them. You also need a special shank to put them on the Dremel, but they are fabulous. I know there's some controversy about the nail dust that a Dremel kicks up, and we're going to cover that in another webcast about myconic nails. But realize that, yes, it kicks up particulate matter. If you have asthma, any kind of lung problems like that, it's a problem. You need to wear a mask or not do this particular kind of procedure. But it does not have any potential whatsoever to create fungal infections in the lungs. I know that's the common thought. There is nothing in the literature ever in history to show that you can get a fungal pulmonary infection from the sanding, aerosolization from nails, even myconic nails. So if you have to work with that in your facility, look at that webcast so you can get more into detail of it. But I love it, and I can't do my nail care appropriately without a sander. So in a nail like this, the proximal edge is fine. You just need the distal edge. It's already short enough. There's nothing you can really do with a clipper on this. You need to sand it. So you're going to just very gently sand the edge of that, make that smooth and bevel down, make it nice and pretty so that it not only looks better, but it's going to grow out well and not catch on socks or rip off before the patient can get back to see you again. Similar situations, mostly just distally, although these are a little bit longer than I'd like them to be. I'd like this to be down about there. But with most thick nails, what I'm going to do is sand it first. It's so much easier to clip it appropriately if it's thinner. You can't clip a nail appropriately if it's too thick, and it tends to split and crumble and make it very difficult for you. So I would sand these nails first to make them thinner on the distal portion. I might even sand it more proximally here just to make that smoother. It's kind of a ridged nail. Then I would cut it as short as I wanted it, and then do a final little sand just to make it very soft at the end, smooth rather. I don't want it to be craggly at the end after I've cut it. I always, as a very last step, sand it to make it smooth at the very tip. Some nails only grow tall. They don't grow long at all. This nail does not grow long anymore. It only grows tall. You can do a little bit with the clipper, I suppose, if you needed to get this down a little thinner. But this is about a ½ inch tall. I don't know if you can tell that in this picture. You really have to sand it. And it's going to be very difficult and time-consuming to do that with a manual sander. So this is a perfect example of something that gets fixed within a minute once you know how to do it with the sander. So this would be a sanding situation. How far down can you sand it? You can sand it down to skin. There is just normal skin underneath nails. Now, I'm not suggesting you have to do it this far down. This is just for demonstration so you can see that you can do it that far down. I like to get the nails as thin as possible. That's the way the person is the safest from shoe pressure on a thick nail, which is painful if they're not neuropathic, but also can create infections and ulcerations. Those ½ inch and ¼ inch thick nails with shoes that aren't appropriately extra depth cause a lot of pressure and can cause problems. So I get them as thin as possible. I do warn the patient if I thin it a lot that it's going to be sensitive for a couple of days, but then it'll be fine. What's the worst case scenario if you thin it too far? You kind of scratch the skin the same way you would if you use the Dremel up here. You're just going to create a scratch. It's not a cut. It's not anything difficult. Even if the person is on blood thinners, it usually doesn't bleed very much, although I admit I have silver nitrate sticks in my kit so that I can handle any bleeding. But for the most part, you finish what you're doing, you clean it up appropriately with betadine or whatever your favorite antiseptic is. You might then put a topical antibiotic and a Band-Aid on it. It's fine. Even a very high-risk person, it's fine. So do you have to make it as thin as this picture is showing? No. But I want you to know that that's doable without any problems. What about this kind of nail where it's curved like this? That's called either an omega nail or a pincer nail. How do you cut a dystrophic nail like that? Well, you can't cut it straight across. It's not straight across. So you have to aim the direction of your clippers, the direction the nail is at that spot. So remember, we're going to be taking 2 or 3 millimeter nips. So nip, nip, nip. And you're changing the direction of the clipper all the way around as you go. So it might take 15, 20 nips to get all the way around this. And you're changing the angle of incident of the clipper the entire way around. It does not hurt to cut toenails. If your patient is in pain, you've done something wrong. You've either held the clipper at the wrong angle, you've nipped them with the clipper, you have used the curette too aggressively. Things don't usually bleed and things don't usually hurt if you do toenail appropriately, even with the most difficult dystrophic nails. So with these these curved omega nails, be sure to move the clipper in the same direction as the nail is at that spot. So you can't go straight across. That would lift up this edge, which would be painful. You have to start here and change the direction of the clipper as you go around. Same for all of these. Very thick nails. You could do some stuff with clippers with these if you don't have access or the skills with a Dremel, although you need to start trying with it. This can be taken care of in just minutes with the Dremel. You can do it with a manual sander. It just takes a very long time. So if you don't have access to a Dremel, what you might do is just clip it as best you can across, not just the end, but the top as well, kind of like you're sculpting. Get it down as far as you can, and use a manual sanding a sanding emery disc or something like that to sand the rest of it. That's a safe way to do it too. It just takes a lot longer. So my favorite way to do this is with a Dremel. And you can see how far down you get them. That is so safe. That person can go for months without getting foot care, and they're extremely safe. They're not going to get ingrown. They're not going to get pressure sores. And you can see from this skin, look how thin this skin is. Very dry, thin, atrophic skin. You can tell by the way this skin looks that this person does not have great vascular supply. So you want to do the maximum you can to create a safe situation for this person. This is the same toe from the side. You can see how tall that is. So if you were having to use clippers, maybe you're going to clip to get all this debulked off and then use a manual sander to make it flatter. But I like to just do it with the Dremel. They can even polish this when you're done. I don't care. We're not trying to solve onychomycosis here. There's a separate video on fungal nails, and you'll learn a lot about that. But what you will learn is that we can't cure it. What we're going to do is make the patient safe, and that's what we're doing here. So grind those down any way you can, as far as you can, and keep them safe. Thanks for watching this. I hope it helps you feel more confident in your nail care. You've seen some examples of difficult nails that are actually very easy to treat. Remember that nail care is not bloody. It is not painful if it's done properly. You might check our website. We do have some hands-on nail courses that we offer, as well as longer full-day WOCN certified toenail courses. So you can check on the website for that. But I hope you go out and right now and start doing nail care. You're medical professionals. These people need your help to do this, and they love you for it. It's a real win-win situation. So I hope this was helpful. I hope you enjoyed it, and I look forward to seeing you on another program.